Well, with today being World Diabetes Day, we are joined in studio by Dr. Lebogang Masunyane. He is the clinical research physician in endocrinology at the Eli Lilly Pharmaceuticals Company for Sub-Saharan Africa. You guys have worked hard for your titles, as well as Greg Bryant, country manager at Bayer Diabetes Care for South Africa. Gentlemen, thank you so much for joining us today. I feel honored to have such intelligent gentlemen around me today. So educate the nation. Lebo, maybe let's start with you. When I introduced you, sir, I mentioned endocrinology. Maybe if you can unpack what that is.
Well, if we're talking endocrinology, we're talking hormones. So that is basically the study of the hormone system. So you're looking at your testosterone, estrogen, insulin, which is very important for diabetes. And you're also looking at things like the pituitary gland that releases the growth hormone and so on. So endocrinology basically looks at that. So we, from our side, we do the growth hormone and insulin. So we kind of very focus on diabetes business at Eli Lilly.
In other words, you're the specialist when it comes to diabetes.
I wouldn't say that much, but like, yeah, I'm quite immersed in the knowledge and the data from on a day-to-day basis, and it's a passion of mine, especially getting people as well as we can improving their lives and outcomes.
Fantastic. Maybe you can share some numbers with us then on the amount of people that are affected within South Africa and the sub-Saharan African region.
Okay. So globally, we have about 382 million people affected by diabetes. We have 7 billion people in the world, so it doesn't resonate. But if you compare that to HIV, it's about 36 million people. So that is 10 times as many people with diabetes as there are with HIV. In the sub-Saharan region, you have 20 million people affected with diabetes. And in South Africa specifically, you're sitting at about 2.7 million people with diabetes, a prevalence that comes out to about 8% of the population between ages of 20 to about 79 being affected by diabetes. So that excludes the children, but like it varies according to ethnicity as well. So you have a higher prevalence in the Indian population, in the mixed race population, and then recently there's been studied that's shown that the urban black population have got a prevalence sitting at about 13.1% prevalence of diabetes, and that goes up all the way to about 38% in the age group of above 65. So it is quite a shocking statistic, and then considering that in the subcontinent, like in Sub-Sahara, you have about 62% of people undiagnosed with diabetes in that figure of 20 million. So we only know about those that come and have been diagnosed and been treated. So it means like you have an overwhelming majority that is not being treated, and therefore complications and a huge economic burden on the health system.
Exactly. Well, we do have some numbers up on screen, just divulging those numbers slightly further that you did make mention of. But Greg, your organization, you're trying to help those who might not be aware and those who are aware of this illness to actually keep tabs on it and monitor it quite aggressively. Maybe if you can tell us a little bit more about your organization and the technological advances you've made in testing.
Certainly. A day like today is actually very important because there's numerous venues that people in South Africa can actually visit to go and get themselves tested, to go and get themselves screened and have a blood glucose reading taken. Our company supplies blood glucose monitors, and these are critically important in determining your blood glucose levels. And it's a partnership in the sense that if you were to be diagnosed as a diabetic, you need to use your blood glucose monitoring device to determine your reading, to determine your blood glucose level, and then you need to calibrate the medicine that is prescribed for you. So we on the other end of the spectrum, in the sense that we are almost like a service provider, I suppose, where we've got a service that we can offer, we've got a meter that we can offer that gives a result to a diabetic.
Do you work hand in hand with healthcare institutions to distribute these kind of equipment?
We do. There are examples of that. We try wherever possible to look for opportunities to partner with institutions and to afford them the opportunity of using our devices.
Earlier on, Doctor, you mentioned the financial burden, not only on the healthcare system, but overall on the economy. And I take it this comes down to specialist endocrinologists?
Endocrinologists, yes.
Exactly, and the lack thereof of them in South Africa.
Well, the lack is actually all over the world. Even in the US, they're struggling to get enough endocrinologists. So you don't have a lot of people specializing in endocrinologists, and also the funding for it is highly desired. You have about 37 in public health sector, and then you have about 40 in private practice, and some of these...
like you to repeat those numbers again, because it's scary. When you say 37 in public healthcare, we have a population of 50 plus people.
So you can see that there's a huge burden. So 37 in the public health sphere, and then you have only about 40 in the public and the private sector actually. So now you have a population this huge, and especially for the public sector, it's the problem. 90% of patients with diabetes are going to be seen by a general practitioner who's not well equipped to be able to manage a diabetes patient, and this is a very serious problem for our side and for the economy as well. So these are things that we have to think about. How do we improve endocrinology? How do we improve care for patients with diabetes? How can we resource, even if we don't get endocrinologists, those that are taking care of those patients, that general practitioners, can we upskill them to the point that they have the same level of expertise to be able to take care of those diabetic patients? And that is something that will be very interesting to look at in terms of investing in.
Maybe, Greg, we can come to you on that one. Are we seeing increased investment in trying to alleviate this issue?
Yes, certainly. You know, we always, as an industry, we're always looking at opportunities to try and educate where at all possible, and to try and expose people. So there's definitely room to explore that in the future.
And the funding and investment, some of it coming from offshore?
Certainly, certainly there is that form of investment that does come into the country, but as things stand at the moment, you know, we very much are reliant on just trying wherever possible to bring new technology to the market, and trying our best to introduce that new technology so that diabetics are more comfortable with the devices. The devices are easier to use, they're easier to understand, and it's a lot easier to interpret the information by keeping it in a logbook, or even using a computer application to keep track of things.
Yeah. Doctor, just to get closing points from you, on a scale of 1 to 10, how far are we from making progress?
We are minus 150. So we're not quite. It's still a very abstract concern in the public. Social consciousness is not quite where it needs to be in terms of awareness. So we really need to build that awareness, and this is part of our journey at Eli Lilly, to try to educate as many people and make them aware through the programs such as these, and also making them aware that they need to practice healthy living, which starts with eating a healthy breakfast, exercise, and also look at your diet throughout the day. So this is very important for us.
Sure. Harsh realities that South Africans need to face. Gentlemen, thank you so much for joining us today and sharing your insights. Hopefully through more partnerships like these at the desk, we will be able to manage to bring down that score from minus 150, Doctor. But that was Dr. Lebogang Masunyane. He is the clinical research physician in endocrinology at the Eli Lilly Pharmaceuticals for Sub-Saharan Africa, and Greg Bryant, country manager at Bayer Diabetes Care for South Africa.